And we begin with the personal impact from one of America's premier health professionals, Dr. Atul Gawande, a surgeon at Brigham and Women's Hospital in Boston, a professor at Harvard, a staff writer at The New Yorker, and an author of 4 New York Times bestsellers, most recently, Being Mortal, Medicine and What Matters in the End. Dr. Gawande, thanks for joining us this morning. So speak from the perspective of a doctor first. What's your biggest concern with this bill?
I read the bill, and there are 3 concerns. One is the weakening of the protections for people with pre-existing conditions. Another is the major cuts in the number of people who actually are on Medicaid coverage. And then the third is the increased costs for people who buy insurance on their own, especially if they're over 50.
So let's take those one at a time, starting with the pre-existing conditions. Got so much attention this week, particularly after that monologue from Jimmy Kimmel. I want to show a bit of that.
If your baby is going to die, and it doesn't have to, it shouldn't matter how much money you make. I think that's something that, whether you're a Republican or a Democrat or something else, we all agree on that, right? I mean, we do.
Now, we know what happened with the House bill. They were basically giving the states the option to waive the requirements so that people could be charged higher premiums who had pre-existing conditions. They also added some money to pay for that. The president looks at all that and says that the coverage for pre-existing conditions will be the same now as it was under Obamacare. Your response?
Well, it's hard for me to watch that Jimmy Kimmel clip because my own son, who is in his 20s and has almost the same heart condition, when he turns 27, he has to go out on a market, and most of the jobs he has had are freelance jobs with no benefits. He's like 1 in 4 Americans that are with histories of cancers, diabetes, or heart conditions. And my worry as a father, as a cancer surgeon, is that when we say we're going to put people into high-risk pools, we've seen what that is. High-risk pools are separate insurance plans for people with pre-existing conditions, and they've historically had very low coverage, waiting lists, poorer coverage, and high costs. It's chilling to imagine my telling my son those are where he would end up going, or my own patients.
And then the Medicaid savings, about $880 billion in savings, according to the Congressional Budget Office.
Right. It cuts the 70 million people on Medicaid by about 1/4, and for the rest of the people, cap, whether it's the elderly in nursing homes, people who are working poor, the cap would mean that the coverage becomes limited.
And then finally, that because of the way they affect the subsidy, some older and sicker Americans will be paying more.
Yes. People who are over 50 can be charged under this new bill up to 5 times more than younger people.
But how about if you take the flip side? It's very clear right now for a lot of younger and healthier Americans, their premiums have gone up under Obamacare. We've also seen insurance companies facing losses, a lot of insurance companies facing losses in states most recently like Virginia and Iowa, big insurance companies pulling out of those states. That fuels the president's argument, the speaker's argument, that Obamacare is collapsing.
So the core thing that's happening is that there's uncertainty in the market about will there be subsidies, will there be mandates, and so the insurers don't know how to price and are pulling out. Here's the thing to understand is that this is a bill that makes each measure of health and healthcare worse rather than better than under Obamacare. It's not a proposal that anybody would put forward as a credible or sane proposal for solving the problems in Obamacare.
Why not?
Well, the core reasons are, number one, it doesn't have the subsidies. So by cutting the subsidies substantially, we're taking $1 trillion away from support for people's health care in the bottom 40%, and returning it as a tax cut to the top 2%. So you take $1 trillion of support out of health care, where it's ending income-based subsidies, turning them into age-based subsidies, and that ends up hurting people across the board, especially in that bottom 40%.
So given the fact that there are problems right now with Obamacare, what would you do to fix it?
The biggest things I would do is, first of all, the aim is that we guarantee that it's good for the patient, right? And the biggest ways to be able to fix that is ensure that you have, the average person's out there with a $24 deductible under Obamacare. We want to be able to open up the subsidies so people have better coverage. That will mean that we continue the plan that secures the insurers to be able to offer coverage under it. The best way to put it, last year insurers had made actually a profit by participating in the exchanges. If they have certainty and know that the rules allow them to protect pre-existing conditions, and offer a minimum benefit coverage, including maternity care and mental health, they're in a place where the market can be restabilized. And then keep Medicaid coverage going. There are 19 states that haven't expanded Medicaid coverage. Allowing a Republican president to offer Medicaid coverage to the rest of the country would actually make conditions better for us all.
Dr. Wande, thanks for your time this morning.
Thank you.
Let's bring this now to the Speaker of the House, Paul Ryan.